So here's the results for that little simulation that you're going to do. Maybe you did it already, but the normal levels of glucose is called normal glycemic, right? And this is before adding the insulin. So if you're normal, the fish should be swimming at a normal regular speed, right? After you add the 15 seconds after you add the insulin, you're going to see that the fish is still swimming normally, and that the blood should be normal glycemic, meaning normal. But after a minute, the insulin will start doing its job, and the fish is going to look a lot more lethargic, and they're not going to have their dorsal fin, which is the fin on their back, really straight up. That helps them for swimming, but it's going to be droopy, and that is an indication that the fish is hypoglycemic. So hypo means low sugar levels, low glucose level, and the opposite for somebody with diabetes will be hyperglycemic, right? So it takes about a minute for the fish to respond to insulin. For humans, after we eat, it takes about 2 hours for us to go back to normal, okay? So here's what I was telling you, that in this picture, they have taken the liver out, which the liver will be kind of like all over the pancreas on top. When you first see a cadaver and you open the abdominal cavity, the first thing you're going to see is the liver. The liver is our largest organ, and so it's covering the pancreas, and it's also covering the stomach. So there's a lot of organs that are deeper in the body cavity, so that any changes in the pancreas as an organ is hard to detect very, very fast, right? The patient may start with not feeling good or feeling indigestion, and they're going to look for anything else except for pancreatic cancer, which is very common, and especially in people that drink a lot, right? So the pancreas, as I mentioned, is both is an endocrine and an exocrine organ. The exocrine portion is represented here by this yellow duct, which is pancreatic duct. So anything that secretes their secretions in ducts and into organs or into a surface is considered exocrine. So if you think about a salivary gland, it's an exocrine gland because it has ducts that secrete saliva into the oral cavity. The pancreatic ducts, they secrete pancreatic juice into the first portion of the small intestine, which is the duodenum. So that's the exocrine portion of this organ. And then in several little islets, they're called pancreatic islets or islets of Langerhans. That's where the endocrine function comes from. And we have little groups of cells, and one type, which is the beta cells, secrete insulin. There's also what they're called the alpha cells. Alpha cells in those pancreatic islets secrete glucagon, which is the name of the other hormone. I'll write it down. Glucagon. So glucagon is the antagonist hormone to insulin, and it's secreted by alpha cells, okay? Alpha. Beta is insulin, and then we also have in those islets delta cells, which secrete somatostatin. So I'll write it on the other side. Somatostatin. So somatostatin, we're going to refer to in the lecture, has to do with blocking or inhibiting the growth hormone. But the two most important ones for glucose metabolism, obviously, is alpha and beta cells in the pancreatic islets. So beta is insulin, alpha is glucagon. So when is glucagon secreted is when your glucose levels are dropping in blood. So if you are fasting, for example, and you know, humans will go into fasting state after probably 3 or 4 hours after eating. And if you don't eat anything, then you don't have enough glucose for your cells to do cellular respiration. So that's a signal for glucagon to be secreted. And glucagon is going to go to the liver storage of glycogen, and it's going to remove some glucose out of glycogen and dump it into circulation. So our cells can continue on with cellular respiration. So when you eat, we know that insulin is secreted. When you fast, glucagon is secreted. So this is just a recap or a summary of the little virtual simulation that we do with the fish. Normal glycemia, we know they have normal levels of glucose, and the swimming behavior will be normal, regular. Dorsal fin will be up, and so the fish can be swimming in a normal manner. Hyper is too high of blood sugar, so the fish will be a little crazy, swimming very, very fast and darting everywhere in the little beaker. And then if the blood glucose is low because of insulin, we're going to have a hyperglycemia, and that's when the fish will be lethargic, not swimming fast, and droopy dorsal fin. Now, if you have an excess insulin, that could be dangerous as well. That could be putting the patient in a hypoglycemic shock. And that happens sometimes when patients, they haven't eaten, for example, and diabetics, and they still inject insulin, or if somebody wants to kill you, that too, they give you a bunch of insulin and it will cause a hypoglycemic shock, which is that your glucose is so low that your brain will start lacking of glucose. And I don't know if you know, but brain is very sensitive to the lack of glucose. And so it's one of the first organs that suffer not having enough glucose. And obviously the patient can go unconscious and very soon into a coma. And if very serious, the patient can die. So when somebody's into hypoglycemic shock, I think, would that be a question in my discussion board? I forgot. But I think there's a patient that, and this is true, so it's from real life, when patients are going into a hypoglycemic shock, they may sound like they're drunk because they don't have enough glucose in the brain. And so they start slurring the words. And sometimes police or somebody that is stopped at a traffic stop or something, they don't recognize that it's a hypoglycemic shock. And they think that that is a DOI, right? That the patient is drunk and is driving. But a lot of times it's this hypoglycemic shock that needs to be taken care of, because it has all the appearance of somebody being drunk and disoriented, but it's really not having enough glucose in blood. The other little lab simulation that you're going to do, or maybe some of you have done it already, is the thyroid hormone. So thyroid hormone, or thyroxine, that's the name. And let me just write it because there's another name for that. So that's the actual name for the hormone. Thyroxine, or thyroid hormone, is secreted by the thyroid gland, obviously. The thyroid gland is located on the anterior area of your neck, and it has two lobes. It looks pretty much like a butterfly. And I'm not sure if when you do a physical, doctors will always check for your thyroid, right? And a lot of times they will use these two fingers and they make you swallow, because in that they can really detect if the thyroid gland is enlarged. And so that could be a problem. So So they are always checking for the size of the thyroid gland. And I'll tell you later why it could be enlarged. But anyway, in this simulation, we're going to be using virtual mice. We used to do this with real mice, but we're not allowed to do that anymore. So even if we were face-to-face, we'll still be doing this simulation. When I was a student, I used to use mice, frogs, and a lot of little animals like that. But it was now it's considered cruelty to animals, and so we can't do it anymore. Yeah, we were a little cruel long time ago, but they didn't know. So it was fun though, trying to catch a mouse from a cage and try to keep it somewhat still so that you can inject the mouse with some pharmacological agent and then watch it and see what happened, right? That's really cruel. So we use them here in this virtual simulation, and these two little mice are going to be, one is not going to be fed with this particular food, but the other is going to be fed with PTU, which is short for propylthiouracil. So we know that PTU blocks thyroxine. So the mouse that eats this food with PTU obviously is going to have a lower thyroid hormone or thyroxine available, right? So obviously the control will be our mouse with no PTU, and our experimental will be the mouse with PTU. And what are we going to measure is oxygen consumption. So oxygen consumption is a measure of metabolic activity, right? And why? Because thyroxine or thyroid hormone has to do with metabolism. The higher your thyroxine, the higher your metabolism, the more oxygen you consume. The lower your thyroid hormone, the lower your metabolism, and you consume less oxygen. The other thing that we're doing is we are varying the temperature of these two little animals in a little metabolic chamber and see how they react at different temperatures. And the reason we do that is that if we have a normal thyroid hormone or thyroxine, and you are in a situation of a very low temperature, your body is going to be able to keep your body temperature longer when your thyroid hormone is normal. And after a while, obviously, you're going to start shivering because you're cold. And the shivering in the normal individual is that causes small contractions of the skeletal muscle, which is going to increase the body temperature. Remember, we have to keep a fairly stable body temperature. So in situations where patients are placed in very cold conditions, it's very important to have this shivering effect after your thyroid cannot do it anymore, keeping your body temperature, because you have to keep your heart and your brain functioning, right? You don't want to get into freezing conditions. So your vital organs, heart, lungs, brain, they need to keep that temperature. That's the reason why if you're lost in the middle of nowhere in a freezing mountain, what happens? You're not only going to be shivering, but also the body will restrict the blood flow to fingers, toes, extremities, even nose, ears, right? You've noticed that people that have been lost in freezing mountains, sometimes they lose the tip of their nose to necrotic tissue because there's no blood supply there. They lose fingers, they lose toes, but it's much better that and be alive than dying, right? So that's the reason is that we have to keep your vital organs that are going to keep you alive with the same temperature. So heart, respiratory, and brain, that's what happens. But with these two little mice, and we're going to change the temperature and we're going to see what happens as we change the temperature. We're going to see what happens with oxygen consumption. So when you have hypothyroidism, these are individuals that don't produce enough thyroid hormone. then the body will be always kind of like in a low body temperature. It also makes you lethargic, tired, okay? You're not as alert. So then I'm gonna tell you a story about women when we start getting close to 40 and what happens to our hormone, especially thyroid hormone. Now the PTU, propylthiouracil, is the one that blocks the thyroid hormone, like I told you before, right? So how we're gonna measure the oxygen consumption? We're gonna use a respirometer. This is the same that sometimes is used to measure respiratory volumes, and we're gonna see that in chapter 16. And obviously, we need oxygen to produce ATP, which in turn makes you have the energy you need to keep with all your metabolic functions. And so thyroid hormone has to do a lot with metabolic functions, right? And we're gonna put this little mice inside this chamber to measure the oxygen. And we're also gonna add some soda lime, which is going to absorb the carbon dioxide that the mice are going to exhale out. If you leave that there, then we're gonna be having an effect on oxygen. So once we have the soda lime absorbing all the carbon dioxide being exhaled, we know that we're just measuring that oxygen consumption. And also, you have to take into consideration the weight of the mouse, because, for example, measuring the metabolic rate for somebody has to do with your weight as well. So a person that is larger, has more muscular mass, will have a higher oxygen consumption and a higher metabolic rate than somebody that is very small or has very small skeletal muscle mass. So that's why we have to weigh our little virtual mouse. So here you have the chamber. So this is the chamber right here. You can see that one of them is already in there. And down here below is where you have your soda lime to absorb the carbon dioxide. And then you have a pipette that is going to measure how much oxygen this little one is consuming. So the oxygen that we have in here is set. So any movement in the pipette will indicate that there are milliliters of oxygen consumed by this mouse. And then we'll put them at a specific temperature. In this case, we have set up the thermostat at 22, which is fairly room temperature, we would say, right? In 22 Celsius. Remember that in science, we always measure in Celsius and not Fahrenheit. So you're gonna do the same for both little mice, the treated with PTU and the normal one. And we're gonna be changing the temperature higher or lower. And at the end, you're gonna end up with a graph that looks something like this. So on the x-axis, we're gonna have the temperature in Celsius. So we've tried this mouse at 10, at 14, at 18, and at 22. So at 22 is most what we call the basal metabolic rate. It will be the baseline room temperature. That's what it will be. And then as we start cooling down that chamber, you know what happens. You can tell what's going on with the oxygen consumption, right? So the control mouse or the normal one, as we decrease the temperature, the oxygen increases, but not as much as the experimental one. If you notice, the experimental one starts fairly with the normal, but because it doesn't have thyroid hormone to keep that oxygen consumption fairly stable to keep the body temperature, the experimental starts getting cold and it will start to shiver a lot faster than the control mouse at a lower temperature, and also it's going to consume more oxygen. So when I show you this in our next exam, and I tell me the relationship between temperature and oxygen consumption, what you have to say is that at as the temperature decreases, the oxygen consumption increases. And so here we will have an indirect relationship, right? Indirectly proportional. As the temperature goes down, the oxygen goes up. That's how we have to answer that question. So any questions on this? On the two little simulations, of course, in this little PowerPoint, I didn't take pictures of the other one or the different temperatures, but you're going to be changing the temperature and recording the different oxygen consumption for both of the mice. And then the graph is going to be created for you. And they're going to ask you what to put on the X and what to put on the Y. If you get it wrong, they will tell you, no, this is where you have to put. And then you just click create and you get your little graph. So I suggest that you screenshot the graph or take it from my pre-lab when you study for the exam, because like that, you're going to have that little graph, and you know I like graphs. All right.